Summer's unseen dangers, a world of tiny biters. Summer is here. It's time for sunshine, picnics, and adventures in the great outdoors. But amidst the fun, a hidden world awakens. Insects, tiny creatures we often overlook, become more active. While most are harmless, some can deliver a painful bite or sting, putting a damper on your summer fun. This isn't about scaring you, it's about empowerment. Knowing how to identify bites and protect yourself is key to enjoying a safe and enjoyable summer. From the common mosquito to the stealthy tick, let's explore the world of insect bites and learn how to stay safe. We'll uncover the secrets of these tiny biters. You'll know what to look for, how to react, and most importantly, how to prevent bites in the first place. Remember, a little knowledge goes a long way in the great outdoors. So, let's dive in and discover how to outsmart these tiny creatures and keep those summer smiles beaming. The itchy truth identifying common insect bites. The first step to treating an insect bite is knowing what bit you. Sounds simple, but with so many insects out there, it can be tricky. Let's break down the usual suspects and their telltale signs. Mosquitoes, those pesky party crashers, leave behind itchy red bumps. These bumps often appear in clusters and are usually harmless, though annoyingly itchy. Fleas, on the other hand, target ankles and feet, leaving behind small, red, itchy dots, often in groups of 3 or 4. Ants, especially fire ants, pack a painful punch. Their bites result in red welts that develop into fluid-filled blisters. Bees and wasps leave behind a sharp, stinging pain followed by redness and swelling around a central white spot where the stinger may have been left behind. Knowing the culprit helps determine the best course of action. But remember, if you're ever unsure or experiencing severe symptoms, always seek medical attention. Ticks. Tiny bloodsuckers with a big bite. Ticks are small, parasitic arachnids that feast on the blood of animals and humans. Unlike other insects that bite and fly away, ticks latch onto their host, often going unnoticed for hours or even days. This makes them particularly dangerous, as they can transmit diseases like Lyme disease. Tick bites themselves are usually painless. You might not even know you've been bitten. That's why it's crucial to check your body thoroughly after spending time outdoors, especially in grassy or wooded areas. Look for small, round, brown, or black bumps attached to the skin. Ticks can be as small as a poppy seed or as large as a pencil eraser. If you find a tick, remove it immediately using fine-tipped tweezers, grasping it close to the skin and pulling upward with steady, even pressure. Remember, early detection and removal are key to preventing tick-borne illnesses. 8-legged foes, spider bites and how to react. Spiders are often feared, and for a good reason. While most spiders are harmless, some species like the black widow and brown recluse can deliver venomous bites requiring immediate medical attention. Black widow spiders are shiny black with a distinctive red hourglass shape on their abdomen. Their bites cause sharp pain, muscle cramps, and sweating. Brown recluse spiders are brown with a violin-shaped marking on their back. Their bites often cause minimal pain, but can lead to tissue damage and a necrotic lesion if left untreated. If you suspect a spider bite, especially from a black widow or brown recluse, seek medical attention immediately. Clean the bite with soap and water, apply a cold compress, and elevate the affected area. If possible, try to capture the spider for identification, but do not attempt to catch it if it's still alive. Section 5. Beyond the bite, allergic reactions and when to worry. Most insect bites cause mild, localized reactions like itching, redness, and swelling. However, some people experience more severe allergic reactions, known as anaphylaxis. Anaphylaxis is a life-threatening allergic reaction that can occur within minutes of an insect sting or bite. Symptoms include hives, swelling of the face, throat, or tongue, difficulty breathing, wheezing, dizziness, and a rapid heartbeat. If you or someone you are with experiences any of these symptoms after an insect bite or sting, call 911 or your local emergency number immediately. Anaphylaxis requires immediate medical attention and can be fatal if left untreated. Remember, it's always better to err on the side of caution when it comes to allergic reactions. Section 6. Preventing bites, your best defense against summer's pests. The best way to deal with insect bites is to avoid them altogether. While you can't completely eliminate the risk, especially when venturing outdoors, there are several steps you can take to significantly reduce your chances of getting bitten. First, wear protective clothing when spending time outdoors, especially in areas known to harbor insects. Long sleeves, long pants, socks, and closed-toe shoes can act as a barrier against biting insects. Light-colored clothing makes it easier to spot ticks and other insects crawling on you. Second, use insect repellent containing DEET, picaridin, or oil of lemon eucalyptus on exposed skin. Follow the instructions on the product label carefully. Avoid using insect repellent on infants younger than 2 months old. Third, be mindful of your surroundings. Avoid areas known to harbor insects, such as tall grass, stagnant water, and dense vegetation. Keep your campsite clean and free of food scraps to avoid attracting ants and other insects. Section 7, First Aid 101. What to do when you get bitten. Despite your best efforts, you might still get bitten by an insect. Don't panic. Most insect bites are harmless and can be treated effectively at home. The first step is to clean the bite area thoroughly with soap and water. This helps prevent infection. Apply a cold compress or ice pack wrapped in a thin cloth to the bite area to reduce swelling and itching. Over-the-counter antihistamine creams or oral antihistamines can help relieve itching. Avoid scratching the bite area, as this can break the skin and increase the risk of infection. If the bite area becomes increasingly painful, swollen red, or shows signs of infection such as pus or red streaks radiating outward from the bite, consult a doctor immediately. Section 8. Home remedies, soothing the itch and reducing swelling. While over-the-counter remedies are readily available, sometimes you just need a quick fix using items you probably already have at home. Here are a few tried-and-true home remedies for soothing insect bites. A paste made from baking soda and water can work wonders for itching. Apply it to the bite area for 10 to 15 minutes, then rinse it off with cool water. Oatmeal baths are another excellent option for widespread itching, especially for children. Aloe vera, known for its soothing properties, can help reduce redness and inflammation. Apply aloe vera gel directly to the bite area several times a day. Cold compresses, as mentioned earlier, are also effective in reducing swelling and itching. Remember, home remedies can provide temporary relief, but if your symptoms worsen or don't improve, consult a doctor. Section 9. Seeking medical attention. When to call the doctor. Most insect bites are harmless and can be managed at home. However, there are situations where seeking medical attention is crucial. If you experience any of the following, don't hesitate to contact your doctor or seek immediate medical care. Signs of infection. If the bite area becomes increasingly red, swollen, painful, or if you notice pus or red streaks radiating outward from the bite, it could be a sign of infection requiring medical attention. Severe allergic reaction. Anaphylaxis is a life-threatening allergic reaction that can occur rapidly after an insect sting or bite. Symptoms include hives, swelling of the face, throat or tongue, difficulty breathing, wheezing, dizziness, and a rapid heartbeat. Call 911 immediately if you or someone you are with experiences these symptoms. Suspected tick-borne illness. If you've been bitten by a tick and develop flu-like symptoms, a rash, fever, headache, muscle aches, or joint pain, see your doctor immediately. Tick-borne illnesses can be serious if left untreated. Uncertainty about the biter. If you're unsure what bit you, especially if you suspect a venomous spider or insect, seek medical attention to be safe. Remember, it's always better to err on the side of caution when it comes to your health. Section 10. Kids and bugs, protecting little ones from bites. Children, with their boundless energy and love for exploring, are especially vulnerable to insect bites. Their delicate skin can react more severely to bites, making it essential to take extra precautions to protect them. Dress children in protective clothing when venturing outdoors, covering as much skin as possible. Use insect repellent formulated for children, following the instructions on the product label carefully. Avoid using insect repellent on infants younger than 2 months old. Check children thoroughly for ticks after spending time outdoors, especially in grassy or wooded areas. Pay close attention to the scalp, behind the ears, and in skin folds. Teach children about the importance of avoiding ant hills and not disturbing bees or wasps. After a bite, clean the area with soap and water, apply a cold compress, and use over-the-counter anti-itch creams as needed. If your child develops any concerning symptoms, such as a spreading rash, fever, or difficulty breathing, contact your pediatrician immediately. Section 11. Enjoy the outdoors safely. Your guide to a bite-free summer. Summer is a time for adventure, and that often means venturing into the great outdoors. While insects are an inevitable part of nature, knowing how to protect yourself and your loved ones from bites can make all the difference in enjoying a safe and memorable summer. Remember to wear protective clothing, use insect repellent, be mindful of your surroundings, and perform regular tick checks. Teach children about insect safety and take extra precautions to protect their delicate skin. By staying informed and prepared, you can significantly reduce your risk of insect bites and enjoy all that summer has to offer without those pesky bites putting a damper on your fun. So, go ahead, embrace the outdoors and make lasting summer memories bite-free.